All right, guys, so we're going to be looking at this question. So which of the following is the strongest risk factor for this patient's current condition? So risk factors do come up a lot nowadays in the USMLE Step 1. So let's go ahead and break this down. So right off the bat, we want to see the chief complaint. That'll give us a big clue. So I think I shrank, I've lost some weight, and my back hurts. So we're thinking MSK right away. And we see that the patient is a 68-year-old woman, and she presents to the clinical evaluation for persistent back pain. She feels that her spine feels compressed, and she's probably stooped over for the past year, and she has general fatigue, occasional difficulty standing for long periods. So right off the bat, we want to think about osteoporosis. So let's see more clues if we can find in the physical examination. Okay, so thin elderly women, alert and oriented, and then her spine has thoracic kyphosis. Okay. DEXA scan score is negative 2.7. That's a clue, and as well as begin calcium and vitamin D supplementation on the plan, and consider bisphosphonate therapy. So that really clues into osteoporosis and the fact that she is 68 years old and she's a woman. So let's go ahead and read the options again in the question. So is it low dietary calcium intake? Could be. Is it family history of osteoporosis? No, I don't think we can consider family history risk factor here. Low body mass index. Let's go back to the BMI. So BMI is 19.2, so that is low. However, it's not as low as we want it to be for it to be a risk factor. So it has to be below than 18.5. And then a high BMI, we need to know is that that's a protective for osteoporosis. And then postmenopausal estrogen deficiency, that looks pretty good. And then sedentary lifestyle, I don't think that really is a risk factor. So we're going to be choosing option D, and option D is the right answer, postmenopausal estrogen deficiency. So estrogen deficiency after menopause is the single most important risk factor for osteoporosis in elder women. So estrogen mainly maintains the bone density, right? So it maintains the bone density by inhibiting osteoclast activity, and after menopause, it declines and leads to bone resorption, right? So another way they can just mention this is increased age mentioned as a risk factor. It basically means the same thing. And we need to know that obesity is protective as well. So yeah, just know that. Family history is, important, but then it's secondary as well. And sedentary lifestyle as well is secondary cause. So I do plan on making more risk factor questions because it's very important and it's showing up a lot in the exams these days. So if you guys enjoyed this question, please subscribe, and I'll be making more content later.